Aicha Dodo, and welcome to Tell Me. Now, scientists around the world are racing to develop a vaccine against COVID-19 with 170 candidates tracked by the World Health Organization. Now, the debate is not only who the front runner is or how effective the vaccine may be or how realistic the targets are to develop one before winter, but also it's about public trust. Now, latest studies suggest that many people haven't made up their mind whether they would get vaccinated. And this might have a lot to do with how countries have handled the coronavirus crisis. Now, in this edition of Tell Me, to talk about this further, we'll also be looking at the latest progress in vaccine and whether all countries will also get the vaccine and why people have doubts and concerns. And to talk on this further, joining me on the program today, I have President of Research Aid Networks and virologist Jeremy Rossman, Senior Fellow at the Federation of American Scientists and Health Economist Eric Felding, and also we'll be talking to someone who is anti-vaccination and nutrition and health expert Ryan Alexander. Thank you for joining us on the program today. Now, first of all, as we said, scientists are racing to develop a vaccine against COVID-19. Our health correspondent Nicola Hill looks at where we are with the progress. Let's look at that first.
The race to develop a vaccine against the SARS-CoV-2 virus certainly has many entrants, with the World Health Organization stating around 170 candidates are being developed. 31 are in human trials, with 6 of them at the all-important Phase 3 stage. And there's the claims by Russia that it's already created the first vaccine, although it hasn't held its Phase 3 trials yet. As 40% of vaccines fail in Phase 3, there's no real knowing which or how many of these will be effective. The UK government's hedging its bets and has put orders in for 6 different vaccines. That's 340 million doses. Although so far scientists don't know how many doses each vaccine needs or how long any immunity will last. America's also been shopping, the latest for 100 million doses of the Moderna vaccine. These deals have led to fears of vaccine nationalism, something the WHO is keen to avoid.
We need to prevent vaccine nationalism. And for this reason, WHO is working with governments and the private sector to both accelerate the science through the ACT Accelerator and ensure that new innovations are available to everyone, everywhere, starting with those at highest risk.
In the US, President Trump has said it's possible a vaccine will be available before he goes to the polls on November the 3rd. But this view isn't widely shared. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, says there's risks in rushing out a vaccine, adding, "One of the potential dangers if you prematurely let a vaccine out is that it would make it difficult, if not impossible, for the other vaccines to enroll people in their trial." There's a lot of focus on the Oxford vaccine after initial human trials showed both a strong antibody and T-cell response. According to England's Chief Medical Officer, Professor Chris Whitty, the promise it would be available by autumn is looking unlikely. But Professor Andrew Pollard from the Oxford Vaccine Group is more optimistic, saying, "But it's also just possible we could have enough data to put before regulators this year." Johnson & Johnson have promised 1 billion doses of its potential vaccine by next year, although its Phase 3 trials haven't begun yet. And there's the Chinese vaccine from CanSino Biologics, which was approved by its military in June and apparently is now being given to key workers. But for the rest of the world's population, it's still a waiting game. Nicola Hill, TRT World, London.
Now let's start to talk with you, Jeremy, and hear your thoughts on the race to develop a vaccine. Where are we exactly?
This is an ongoing process. We have a lot of vaccines that have been in development, and now we have multiple vaccines that are progressing through various stages of the clinical trial process. So I think at current estimate, we have 47 vaccines that are in various stages of clinical trials, but there are only 8 vaccines that are in variants of the Phase 3 clinical trials, where we're waiting to see the results before licensing. So it's really important to mention that, in fact, many, up to 40% of vaccines fail in Phase 3 clinical trials. So we have a lot but we're seeing a lot of attrition as it goes, and we will likely see more. So it's a little early to say exactly which vaccine is going to win this race, but we will likely have multiple vaccines that come out at the end.
And it's looking optimistic in your point of view?
Absolutely. I think it's very likely that we will have multiple vaccines that are able to elicit a protective immune response, or at the very least reduce the amount of very severe disease that people are suffering, because it's not just a matter of protecting people, it's also alleviating severe disease and reducing the risk of fatalities. So I think it's very likely that we will have multiple vaccines that will work for this and that will prove safe, but we need to make sure that we have the data before we license the vaccines, that we know the vaccines are safe, and we know that the vaccines are effective. But I am optimistic that by early next year and moving into the summer of next year, we will have multiple vaccines that are available.
And to understand a bit better, what does it mean for the pandemic in terms of immune response?
So in terms of immune response, the vaccines are basically designed to elicit the immune response that you would get if you were naturally infected. And the hope is that this immune response is sufficient so that somebody that just gets the vaccine will then be resistant if they're exposed to the virus and won't get infected at all. But even if the vaccine isn't protective enough to stop the infection, the immune response might be sufficient to prevent very severe disease. So it would still be very useful in terms of that. Now, the issue is right now, we don't know exactly how strong the immune response is that's necessary to prevent infection. And we don't know how long that immune response lasts. So we have to make sure that the vaccine produces an immune response for a long enough time that it's actually effective in the population in stopping transmission of the virus. But this is why we also have things like booster vaccines. So you might need to get 2 shots of the vaccine in order to protect infection. These are things that are ongoing, but it's very likely that this vaccine will be a very strong tool in our arsenal to protect and stop COVID-19 transmission. But it's just one tool. We still have very good public health measures that are also very important for stopping transmission.
And I think to actually talk about the process of the developing vaccine helps us to understand what it means and why we might need it. And this conversation has to be open. So let's bring in epidemiologist and public health expert here, Eric, with you. So as we said, we are looking at vaccination, but where are we now with the coronavirus? I mean, is the worst over, or are we in there for the long haul?
The worst is you can't say for certain it is over. I think, as Dr. Anthony Fauci pointed out, we are in a long haul for a while. This pandemic will extend into not just 2021, but potentially even 2022, because even though the vaccine will be available, whichever one it is, or multiple versions out there, it will still take many, many months, if not over a year, to successfully roll it out to the entire world. And this is a pandemic. And unless you snuff it out and make sure it doesn't crop up anywhere, this epidemic will still rage on until the vaccine is fully rolled out to every corner of the world. And that's why there's a risk of potentially late 2021 and even into 2022 before we get it fully under control.
And now, as we said, many have also shared their views and opinions with us, sending in videos. Let's watch what Dr. Idris Morgan has to say.
Hello there, my name is Dr. Morgan, also known as Dr. Mim on YouTube. I am a doctor and GP trainee here in the UK. Now, along with things like drugs and medications, vaccinations are a tried and tested method of protecting us against and controlling virus outbreaks, much like the one we're experiencing today. And historically, they've even been shown to sometimes eliminate a disease completely, with smallpox as an example. Now, there are currently 2 coronavirus vaccine studies ongoing in the UK at the moment, one at Imperial College London and one at the University of Oxford. And although they have been moving at a much faster and more accelerated rate than anything we've done before, there is still no guarantee that they will be able to provide us with a safe and viable vaccine anytime soon, although that is the hope of us clinicians up and down the country. Now, as a family medicine doctor, I truly believe that forming a relationship with my patients built on a strong foundation of trust and communication is key to helping them understand why I would recommend something like a vaccination. And if they can trust me with things like antibiotics for an infection or a cream for a rash, then hopefully when the discussion moves towards vaccinations, they can understand that I would only recommend it if I truly believed that it would help to keep them and their loved ones safe.
So, Eric, 2 to 3 million deaths are prevented each year through vaccination, but we can see the growing sentiment of anti-vaccination. So do you think governments should mandate COVID-19 vaccination?
Well, there are already many government mandates for vaccinations for measles, mumps, and rubella, and many others. And I think the issue is how many exceptions should we have and allow? Because right now, oftentimes many countries and states, provinces allow religious and whatever self-made up exceptions you want to have. And I think we have to have a limit. But at the same time, we can't push too hard. But the problem right now is that in terms of a current latest poll of different countries, for example, in the United States and Canada, the percentage of people expressing they're willing to take the vaccine right now, if it's available, is only around 68, 69%. Some countries, such as Russia, Poland, France, it's 60% or even less. Although in Asian countries, it's higher. The problem is that may not be enough. Herd immunity does kick in around 60% or more, but with potentially, lower efficacy, because we don't know if there will be a 98% efficacy vaccine like the measles is. If Dr. Fauci says if it's only 70%, and again, only 70% people will take it, then that actually means that the vaccine would not be enough by itself. Therefore, we may have to mandate it or limit the number of exemptions we have in order to control this epidemic.
Well, now let's bring in someone who is anti-vaccination and also a nutrition health expert, Ryan Alexandra. Thank you for joining us, Ryan. So, Ryan, why would you not get vaccinated?
Well, first of all, it's super fun to be invited on here to give the complete opposite view, right? So the question is, why wouldn't I do it? Because I'd stand here and argue against the effectiveness of vaccines. I would say the effectiveness of vaccines is mostly propaganda-based. I would say this epidemic is caused by governments, not necessarily by a health problem. And I would say that all of the suggestions by governments have exacerbated the problem and threatened people's health more. Vaccines are a drug. They're a pharmaceutical drug. A doctor can't prescribe you a pharmaceutical drug without your permission. The panelists are talking about mandatory vaccines. That's the biggest problem that we have. I would rather take a bullet in my head than a vaccine in my arm. And there's a lot of people who feel like me. And I'm completely willing and ready to enter a civil war based on this, because we're actually talking about the fall of our society or not. It's not a slippery slope. This is a cliff face. If we are mandated to take pharmaceutical drugs, we have lost society, basically. And that's how important this is. And we're in the health business. We sell vitamins and minerals. It's got nothing to do with vaccines. Nothing. Right? So if our customer base was to ask me, hey, should I get a vaccine? It's not necessary would be the argument. I'm not going to come here and say that advance an argument for harm, which a lot of people will do. They say don't take vaccines because they're harmful. You can venture into that territory, but we don't need to. My argument would be that they're not effective. It's a hoax that they're effective. I would reference the book Dissolving Illusions, by the way, by Suzanne Humphries as the primary explanation of that argument. And then, again, I would argue about tyranny. I would say I don't care about the effectiveness of a vaccine or a drug or fluoride. It's tyranny to be forced to take a medicine. I have the freedom to choose whether to take a medicine or not. I have the freedom to choose whether to take a vaccine or not. I have the freedom to choose whether I go outside in a rainstorm with a metal rod inviting a lightning struck, right? I have the right to go fishing on slippery rocks and to run up and down stairs and to put myself into harm's way because we live in, quote, the free world. So what we are talking about here is the dissolving of the semblance of the free world.
And though, Ryan, just there, so what about though all the data, all the science, and also maybe you have the option of choosing what you want to do and you can live freely, but what about countries who have poverty, conflicts and wars and to protect children there? And we know that 2 or 3 million people each year are protected because of vaccination, each year don't die because of vaccination.
Well, we say that, we don't know that. Right, and this is again me saying that the argument that vaccines are effective is propaganda, and that's in book length and Dissolving Illusions. I didn't write that book, but it's the primary one that I would go to for that argument. That the fact that they are effective is a falsehood being told to us. I don't agree that they're effective, but even if they were, this is again, even if they were, and I don't care what country you're in, I don't care who you are, you should have the right to refuse medication, period. The government should not have the right to force medication on anyone, period, under any circumstances.
And now we have another video, which is by Ana Fabrega, who shares similar views to you, Ryan, why she wouldn't get vaccinated. Let's watch that and take it from there.
I'm against COVID vaccine, as I don't feel that this is a deadly virus for the general population. I feel that this virus, unfortunately, has deadly consequences for those that have suffered or suffer from previous health conditions. The vaccine has not had the time to be developing the methodologies that the general medical industry operates, which is 3, 5 and 10 years to actually measure the efficiency. Therefore, we could be going into the scenario of everyone be vaccinating with very, very little efficiency, with other consequences for the body. I feel that any virus like this one that is not deadly, as opposed to deadly virus like Ebola or anthrax, I feel like we should allow the body to develop their own immune system, which is, in history has been proven the natural way of doing it. Therefore, yes, I would not be supporting the use of vaccine in either my children or myself.
Now, Ryan, this is how Anna feels, and she shares with you similar views as well. So, but if Anna doesn't get vaccinated, if you don't get vaccinated, if millions don't get vaccinated, doesn't it put other people at risk, or especially people who have underlying health conditions?
I would say that's totally bogus anyways. This herd immunity concept just sounds so silly. It sounds silly to third graders. Why you being vaccinated is supposed to protect you, but yet I have to be vaccinated in order for your vaccine to work. That is completely nonsensical. I have no idea how they even formed the actual philosophy to advance this argument. So that's just trash. It's garbage. And also, I don't care. I just don't care. Again, we're talking about freedom. We live in a free world. I'm promoting freedom. In the health business, we're promoting people to, sorry if it sounds rude to the experts on board, but to fire their medical doctor. To fire their medical doctor for their bad advice and to empower people to make the choice. We tell people all the time, we can't, as alternative practitioners, I can't legally tell you not to take drugs or vaccines, right? I can tell you which drugs have withdrawal effects and not, and I can encourage you to talk with your doctor about it or not. And we can say that if you want to get healed, it's got nothing to do with those drugs. And I can tell my customers that if they are on any pharmaceutical drugs, including a vaccine, it's only going to make my job more difficult in helping them to get healthy. And if they want to be empowered to take care of their own health, which is what we're recommending here, we're actually saying the government is bad for health, that medical doctors and every official health thing is actually bad for health. The World Health Organization is bad for health. If you follow the CDC's guidelines, you will have a problem. If you follow the US government's food plate, you will probably develop diabetes. This is how bad the advice is. So the herd immunity thing, gibberish, nonsense. The fact that this is allowed to be on mainstream channels is totally beyond me. I mean, I talked earlier about saving our society. I really don't know what's left to save.
I believe Ryan here, Eric's got something to say. So let's bring him into this conversation. This is how we actually maybe can understand each other better if we talk, if we do debate. So Eric, yes, to you.
Yeah, hi. So there has been a wealth of data around herd immunity. They do work at a certain level. I'm actually not pro herd immunity without a vaccine. There's those proponents in Sweden who are trying to push for herd immunity. Herd immunity does protect you because, the mathematical and actual scientific evidence all support that. And for him to claim fire all medical doctors, that government is not for is bad for health, WHO is bad for health, these are some of the most ludicrous things I've ever heard. Now, and also just the fact that he simply doesn't care about others. We have, seatbelt laws, we have helmet laws. They're not tyranny to actually to have anti-tobacco rules in public spaces. And so, first of all that tyranny argument is ludicrous because it actually saves more lives. And secondly, there is so much evidence and data, and then for him to simply say they're falsehoods.
So, Ryan, just one last thing. That's what Eric had to say. Now, maybe throughout this whole coronavirus crisis, I know that looking at countries, I feel like I was left without information. I am shielding, I'm at home. I feel like I'm protecting the health system, but it's not maybe protecting me enough. So yes, I believe I don't have enough information to believe in the policies, but I do feel I have to get vaccinated. So if you were critical condition, if you were in hospital, just one last thing to ask you. Would you get vaccinated if they told you that was the only way out?
Knowing what I know now, I will never get vaccinated for any reason.
Well, thank you very much for joining us and sharing your views with us on Tell Me, and it was and good to hear here. So, Jeremy, let's continue with you. What have you got to say to this debate?
I'm not a huge proponent of the idea of mandated vaccination, because what we need is a real conversation about vaccines. And we haven't been having that real conversation about vaccines. Now, I think vaccines are incredibly effective. Not all vaccines are perfectly effective, but there are a lot of people that have a lot of concerns about vaccines. And going out and saying, look, you need to go get a vaccine and you need to put this in your body, this is not going to help this conversation. We need to be talking about people about what is the data.
And when you say talk about, though, looking at and someone who shares anti-vaccination views during the program, and also about people that I've spoken to during this program, also talking to a lot of people, and they said, and one thing they don't feel sure is, which country's vaccine will be safe, or how can I trust it entirely? Whereas where I've been looking throughout this coronavirus time, I haven't trusted the policies of government. So how do you really overcome that and build that trust with people?
Yeah, this is an incredibly difficult part of time right now, because it depends on how governments are actually promoting their vaccines. We've heard about Russia licensing and starting to vaccinate with a vaccine that has no clinical trial data that's ever been published. As a public health professional, this really makes me concerned, because that's not a vaccine that I would endorse right now. And I think that this is an important component, is that we need to make sure that we have the data, that we know that the vaccine works, and that the vaccine is safe before it's being promoted, and that we are talking about specific vaccines. Because each one of these vaccines, we have almost 150 different vaccines that are in development. They're not all going to work the same. And so there's a real burden on governments of the world to make sure that they are being cautious and utilizing the very best data.
So Eric, final question to you, which actually I would have talked a bit more about it. I would have liked to talk a bit more about it, but we didn't have time. So what about the distribution of the vaccine, though, especially looking around the world? What about countries who have poverty, diseases, conflicts? Will everyone have access to a vaccine?
Yeah, I'm hopeful that they will eventually. But at the beginning, unfortunately, I fear there is going to be a whoever developed it gets it first approach in prioritization. And obviously their healthcare workers and essential employees being at the front of that queue. But in these developing countries, I fear that developed countries need to see that unless this epidemic is quashed in every corner of the globe, we will always be living in this eerie nervousness of, is it going to come back? And this is why WHO works hard to quash Ebola outbreaks and many other outbreaks in other parts of the globe, because quashing them and preventing them and making sure there is zero COVID throughout the world is ultimately the solution to ending this pandemic for us to go back to our normal lives. And so we have to prioritize developing countries too, not just those who have the wealth to afford the vaccine at the very beginning.
Eric Felding and Jeremy Rossman, thank you very much for joining the show today and for everything. So thank you very much. And next week on Tell Me, we are looking at the rise of Islamophobia, which has surged during lockdown. And we want to talk about how do we get past this. So let's talk about your experiences. Share with me your concern, your opinions, your thoughts to my Insta account, ChaChaI. And do stay safe and sane until next week.